I'm Dr. Melman. I'm one of the surgeons here at Advanced Surgical and Bariatrics. I've been in practice for almost 10 years now. So a hernia is a hole in a layer of tissue, and through that hole, something else starts to bulge up through it. So basically, when we're doing hernia surgery or hernia repair, we're fixing a hole. Very common at the belly button, that's called an umbilical or a ventral hernia. In prior incisions, if somebody's had a big open surgery, or say they needed a big cut to fix a colon cancer or an abdominal organ or something else, and then had to get that incision sewn up or closed, it's common in that incision where the scar tissue is formed for a hernia or hernias to form. There's also inguinal hernia that's sort of in the groins, right or left side or both sides. That's also a very common place for hernias to form. Hernia surgery is designed to avoid the emergency situation where we're dealing with, intestine that's, threatened, or other abdominal organs that are stuck in the hernia defect and threatened. Hernia usually presents with some pain and a bulge. Sometimes you can push the bulge back in, sometimes you can't. It depends on where in the anatomy the hernia is forming, but most people notice a difference in contour, or they notice an uncomfortable feeling in that area of the anatomy, and they get examined, say, by their primary care doctor, or they just come directly to us to get examined, and that confirms the diagnosis. Common questions are, am I going to need mesh? There's a lot of sort of bad press out there about mesh. Right now, there's more than 200 types of hernia meshes out on the market available to use for hernia repair. Because there are hernias in so many different parts of the anatomy, some of these devices or materials have been designed specifically for one area of the body versus another. Typically, people are back to work within 3 or 4 weeks, depending on how involved the hernia is or how involved the hernia repair is. Now we're doing these repairs with the robotic technique, which is small incisions, no drains, binder, go home the same day, and they're back to work pretty quickly. Hernias and hernia surgery is uniformly covered by insurance, and at Advanced Surgical and Bariatrics, we accept a wide range of insurance plans. There are people that will take your call and make sure that we accept your insurance before you're even booked for an appointment.